recognize your presence. If you are there, let us see you. Thank you for being part of this great day. We have amidst us also officers from the UPDF, and also we have Uganda Police Forces with the senior officers with us, and also the team who are ensuring that our security is fine in this place. Thank you so much for being here with us. We really treasure the time that you give in this very important day being celebrated. And we have also Hillary, who is the Secretary of Social Services here in Hoima, and we want to thank you for being part of this great day. Ladies and gentlemen, we are going to another session, and we shall have a presentation of position paper on inclusive health best practices in disability inclusive healthcare. And as this presentation will be made, we shall have also a team of people who will be in a short panel discussion that will help to digest the area of presentation of this position paper. So as we prepare towards that, I will call upon my colleague, David Ngozi, to take up a seat up there, and he will mention the people who are supposed to come up here for the panel discussion, and as we shall be waiting for them to arrive up here, we shall have the interview going on. Thank you. Can you take this time to invite the team as you also take your seat? Thank you.
Master of Ceremony, Mr. Gardens, I want in a special way to write on already established protocol, and I want to take this singular honor before the presentation of the position paper to invite the following panelists. Shall we organize today's panel discussions on who is the senior health educator for this panel. She is standing on behalf of the senior health officer, Dr. I also would like, in a special way, to invite Dr. to come and join. In a special way, I also want to invite our engineer, Ministry of Health, and gentlemen, once again, my name is Nagusi. This afternoon is a rare privilege for us to present to you a position paper on inclusive health services for persons with disabilities in Uganda. Reason total population according to the 2024 National Population and Housing Census report by the Bureau of Statistics. It is clear, therefore, that Uganda is one of the countries that have made progressive steps in the sub-Saharan Africa in the promotion and protection of the rights of persons with disabilities. These efforts have been demonstrated more so in the ratification of the international treaties, enactment of laws and policies that promote the provision of inclusive health services, and making global commitments on fostering disability inclusion. The ratification of the Convention on the Rights of Persons with Disabilities in 2008, together with its optional protocol, helped to underscore the global guidance for the provision of inclusive health services to persons with disabilities. Article 25 and Article 26, the Convention on the Rights of Persons with Disabilities, provided enormous guidance on fostering inclusive health, rehabilitation of persons with disabilities. Ladies and gentlemen, the enactment of the Persons with Disabilities Act, Chapter 115, and the revised national policy on persons with disabilities have been a stimulus in fostering the implementation of Article 25 and Article 26 on inclusive health services and habilitation and rehabilitation. And these have been one of the domestication and localization efforts. In an effort to leave no one behind, Uganda was one of the countries to embrace sustainable development by embracing sustainable development goals, especially the implementation of SDG 3 on ensuring health lives and promoting the well-being for all at all ages. To enhance the provision of disability inclusive health services, Uganda has made bold steps of committing the Global Disability Summit on inclusive health for persons with disabilities, and this has particularly been the case for the Global Disability Summit of 2022 and the Global Disability Summit of 2025. The Ministry of Health has further reiterated her commitment to disability inclusive healthcare services, which is very key to note. This is more so in the Ministry of Health's 5-year strategic plan, where under strategic intervention 3.8, the ministry has committed to promote the provision of disability-friendly services. Ladies and gentlemen, despite the above efforts, there is still glaring gap in health service delivery towards persons with disabilities in Uganda. This has been demonstrated with the literature review which has been conducted by different institutions, including but not limited Ministry of Gender, Labor and Social Development, National Council for Persons with Disabilities, Equal Opportunities Commission annual reports, and I will make effort to note this to you. According to the Equal Opportunities Commission 2024 annual report on the state of equal opportunities in Uganda, persons with disabilities face unique challenges that often require medical care, which is frequently too expensive for them to afford. The report highlights shortage of public health workers, long distances to health facilities, inadequate training for health practitioners, disability awareness, and restricted access to essential services. Ladies and gentlemen, persons with disabilities, including those with psychosocial disabilities, face challenges such as a lack of community, negative attitudes, and abuse from local service providers and family members, and widespread misconceptions about mental health that hinder understanding and acceptance. Many persons with disabilities have reported experiencing negative attitudes, insults, threats, and physical assault, exploitation, and ill treatment at the hands of local service providers, including police. According to the situational analysis report by the Ministry of Gender and Social Development, persons with disabilities face many of the same health challenges. These include HIV/AIDS, but often experience less access to health care and treatment, and less care is low among persons with disabilities. According to the Ministry of Gender, Labor and Social Development, only 30% of persons with at least a lot of difficulty with the functional activities of using devices. The report highlights a major reason why persons with disabilities experience less access to health care is that they are not seen for funding purposes. The disability status report by the National Council for Disability, now National Council for Persons with Disabilities, highlights the physical inaccessibility to the health facilities with the lack of adjustable beds, limited budgetary allocation to the Disability and Rehabilitation Division of the Ministry of Health, ill treatment by women with disabilities while seeking antenatal care and postnatal prescription drugs for persons with disabilities, including persons with epilepsy, persons with social disabilities, limited skilled health workers to manage different categories of disability health facilities, limited number of neurosurgeons in the country, and limited inclusion of disability health promotion campaigns and services. But it is not enough, ladies and gentlemen, as we celebrate the 38 years of existence, every disability category faces a number of challenges when it comes to accessing health services. According to Autism Society of Uganda, persons with autism face the following related health challenges: stigma and misconceptions about autism, limited awareness and understanding of the autism spectrum disorder, insufficient inclusive education to persons with autism, policy gaps where autism is not highlighted among the disability categories in the Schedule 3 of the Persons with Disabilities Act. The burden on families. Families of persons with autism often face overwhelming challenges requiring support programs for counseling, respite care, and financial aid, which are not always available. Shortage of trained professionals, where we have a dearth of trained professionals in autism care in the country, and of course, we have financial barriers. According to Epilepsy Association of Uganda, persons with epilepsy face the following health-related challenges: irregular medications at health centers due to inadequate information about the uptake of medication by health workers, wrong or misdiagnosis of persons with epilepsy leading to increased medication burden, inadequate skilled staff to handle persons with epilepsy at various health centers, stigma and discrimination towards persons with epilepsy. Ladies and gentlemen, according to Spinal Bifida and Hydrocephalus Association of Uganda, SHAU, persons with spinal bifida and hydrocephalus face the following health-related challenges: lack of access to health care facilities and specialists due to existing few practicing neurosurgeons in the country. Muscle weakness or paralysis, where the damage to the spinal cord and nerves results in muscle weakness or paralysis in the lower extremities, affecting mobility and the ability to walk or stand independently. Loss of sensation, bladder and bowel dysfunction, orthopedic complications, financial constraints, social acceptance of children. Ladies and gentlemen, according to the Foundation of Persons Affected by Graphicism, persons of short stature face the following health-related challenges. We have spinal stenosis, which is the narrowing of the spine canal, which cannot accommodate well the spine, and hence make coordination the way not proper. The tibia bone is another one. It requires correction with support of orthopedic doctors, and yet this does not come with ease because of the financial constraints. Inaccess for health facilities across the country, especially the lack of adjustable beds in the various health facilities across the country, continues to challenge them. The negative attitude by various health service providers. Ladies and gentlemen, according to organizations of persons with albinism face the following health-related challenges: lack of sunscreens in the various health facilities across the country, limited and at times no screening of persons with albinism, According to Uganda Federation of the Hard of Hearing, the following are the health-related challenges faced by persons with hard of hearing. Limited audiology services in most government health centers, both in rural and urban centers. Expensive interventions or support services, both in rehabilitation and assistive technology, more so the purchase of hearing aids or cochlear implants. Most of them cannot afford these because they are expensive. Poor quality assistive listening devices, most of which are on market and accelerate hearing loss instead of supporting one. Here, limited awareness of the hard of hearing persons among healthcare professionals and the necessary support to them. Some of the hard of hearing persons have reported tough experiences in the labor wards during childbirth, emanating from poor communication and unwillingness of midwives to write down necessary information in case of communication barrier. And some hard of hearing persons expecting mothers, especially expecting mothers, have either lost their lives during labor or these have lost their babies. We should get worried about that situation. The healthcare providers lack knowledge and understanding of the communication and access needs for hard of hearing persons, and at times expect them to use sign language, yet not all hard of hearing persons understand or use sign language. And some hard of hearing persons experience attitudinal barriers, including experiencing negative reactions and lack of respectful communication from health care providers. Ladies and gentlemen, according to Mental Health Uganda, persons with mental disabilities, especially those with intellectual and psychosocial disabilities, face these health-related challenges. The first is persons with mental disabilities. And including those with intellectual and psychosocial, they face significant shortage of trained mental health professionals and psychiatrists, clinical psychologists, psychiatric nurses, and counselors. The few are most concentrated in urban centers, leaving rural and remote communities without adequate access to specialized care. The mental health sector, important to note, receives 0.8% of the national health budget, reflecting very low funding for this critical area. Such limited allocation constrains service delivery. The weak coordination between government ministries, particularly Ministry of Health and the Ministry of Gender, Labour and Social Development, undermines integrated approaches to mental health care, rehabilitation, and the social inclusion of persons with mental disabilities. This lack of interministerial collaboration results in fragmented services, inefficiencies, and reduced effectiveness of mental health programs. The medication for mental health conditions remains outdated and in some cases potentially very harmful. Older and in many high-income countries, due to their severe side effects and commonly prescribed mood stabilizers such as lithium, it requires regular liver function monitoring, which is unaffordable for most patients. This lack of access to safe and modern medication further compromises the treatment outcomes. We have stigma and discrimination, which continues to cause major barriers to care, as persons with psychosocial and intellectual disabilities often face negative attitudes from families, communities, and even health professionals. The high cost of treatment and inconsistent availability of essential medicines further exacerbate. The following are the health-related challenges for persons
with physical disabilities. The lack of assistive ability of persons with physical disabilities, in line with Section 7, subsection 7 of the Persons with Disabilities Act, continue to be very challenging. Inaccessible health facilities, with the lack of ramps or substandard ramps and lack of adjustable beds, continue to be very challenging to persons with physical disabilities. In the orthopedic workshops across the country, there is limited on access to essential services like orthopedic care, access to essential services like orthopedic care, occupational therapy, and physiotherapy. At least I have had an effort to visit some of the orthopedic workshops, like the National Referral Orthopedic Workshop, where I raise my shoes periodically. That is a very big gap. There is no designated budget for rehabilitation services, which severely limits the provision of comprehensive care. The 2025-2026 budget allocates 5.8 trillion to health sector, constituting 8.1% of the national budget. Out of this budget allocation, there is little prioritization of rehabilitation services by Ministry of Health, which leads to few functional rehabilitation centers able to serve the needs of persons
care, increased national budgetary allocations towards epilepsy medication. And addressing the challenges faced by hard of hearing persons, this is our call to action. The government should conduct awareness raising about specific reasonable accommodation for the hard of hearing persons, should conduct training of more audiologists across the country and station them both in rural and urban health centers. The government should subsidize medical treatment, medical equipment used in audiology services, or else offer tax exemptions to regulate the expenses for the end users. The government should ensure availability of ear and hearing care services at all levels of healthcare service provision. And government should promote high-quality public health research on ear and hearing care and develop a national research agenda in line with global and national priorities. There is need to train health service providers on the communication and accommodation needs they have of hearing persons, and Ministry of Health should develop a toolkit or handout for health professionals about hearing access and communication that would be shared with all healthcare workers across the country. And early identification, hearing screening, and rehabilitation. The government should establish programs for the early identification and intervention of hearing loss, speech therapy, screening for persons of all ages. In addressing the challenges faced by persons with spina bifida and hydrocephalus, this is the call to action. The government should implement the World Health Organization or World Health Assembly resolution on food fortification. The government should review the essential drugs list to provide oxybutynin for easy access. The government should reconsider the removal of the 18% tax that is levied on pampers or diapers in the Value Added Tax Amendment Act of 2023. Imposing taxes on diapers or pampers, both imported and locally made, is a financial hardship for persons with spina bifida, and this leaves them without the support they require because they are an essential product that supports their health, safety, and dignity. This is because most of them come from impoverished families. The government should prioritize the enhancement of neurosurgery education and the training of additional pediatric neurosurgeons. The government should provide community-based interventions, including through private health care education programs. The government should recognize the official commemoration of the World Spina Bifida and Hydrocephalus Day and ensure provision of the basic incontinence management materials for children with spina bifida. Government should consider an increase in budget allocations to provide for rehabilitation centers at health center force and scale up the numbers of neurosurgeons in the country. Government should develop a national database for persons affected by spina bifida and hydrocephalus conditions to foster disability inclusive planning and budgeting. Government should ensure the provision of assistive devices such as braces, crutches, walkers, or wheelchairs to help improve mobility, independency, and overall quality of life for persons affected by spina bifida conditions. And government should strengthen consultation with service providers in building a solid ground for access to multidisciplinary lifelong care for persons with spina bifida and hydrocephalus. Ladies and gentlemen, in addressing the challenges faced by persons with mental disabilities, this is our call to action. The government should develop and strengthen the capacities of in-service mental health professionals, including psychiatrists, psychologists, psychiatric nurses, social workers, and general health care workers through continuous professional development. The government should increase budgetary allocations for mental health, ensuring sufficient resources for service delivery, infrastructure development, and personal training. The government should foster strong interministerial collaboration
particularly between the Ministry of Health and Ministry of Gender, to implement integrated mental health programs, improve rehabilitation services, and promote the social inclusion of persons with mental disabilities. And government should ensure access to modern, safe, and affordable psychiatric medication for persons with psychosocial disabilities. For medications that require regular monitoring, such as lithium, the government should provide financial support or subsidized monitoring to ensure safe and treatment adherence. And government should integrate mental health services into primary health care and communication and community-based programs by the Ministry of Health, ensuring that rural and underserved populations have access to assessment, treatment, and follow-up care. And government should strengthen the implementation of the mental health laws and policies, including the Mental Health Act, by ensuring adequate funding, enforcement mechanisms, and intersectoral coordination to protect the rights of persons with mental disabilities. Government, together with organizations of persons with disabilities, should promote research and innovations in mental health by encouraging universities and research institutions to conduct studies on prevalence, treatment efficacy, and community-based interventions with the aim of generating evidence to inform policy and improve clinical practice. And lastly, ladies and gentlemen, in addressing the challenges faced by persons with physical disabilities, the government should revitalize the functionality of orthopedic workshops by dedicating financing to equip orthopedic workshops in the local production of assistive technology devices for persons with disabilities. This has been a commitment in the Global Disability Summit of 2022 and is also a commitment in the Global Disability Summit of 2025 by Ministry of Health. Government should ensure the free provision of assistive devices such as wheelchairs to improve affordability and access in line with Section 7, subsection 7 of the Persons with Disabilities Act, which is already a legal imperative. And government should promote universal design in access to health care through construction of ramps and purchase of accessible or adjustable beds to meet the needs of persons with disabilities. Ladies and gentlemen, the Ministry of Health should prioritize budgeting towards equipping orthopedic workshops across the country. According to the 2022 Global Disability Summit, one of the commitments by government through Ministry of Health is equipping at least 40% of the orthopedic workshops across the country. We are yet to register results on this. The Disability Fraternity in Uganda notes that addressing the above recommendations will significantly contribute to the realization of the National Development Plan 4 and Vision 2040, ensuring that no person with disability is left behind in Uganda's healthcare service delivery. This position paper is presented by NUDIPU before you in consultation with organizations of persons with disabilities in Uganda. Most of them are represented here today. I want to dearly thank you for listening.
Thank you so much, our colleague and the moderator of the panelists, for taking us through that. Abataka tujja kusaba mutugumisirize ekihandiiko kibeekirayira kandi niyo ensonga etuleesera hano kya leero kwetegereza ensonga ez'ebyobwomeezi ezikumigiriza itwe abantu abanyakwinaho obulema. Nabwekyo tinja kubigarukamu bibaire bingiho baire babalize munoha ensonga ezikutumigiriza kandi bagonza kucyentura ekirungi twinaho omukuru kuruga mu ministry y'ebyobwomeezi ajja kuba natugarukamu obuli obuteyirweho. Leka tubanze tuhure kuruga hali ba panelists rundi abantu abakomerwege baija kuhanura nsonga eno tujja kuba ntusaba yoko abantu nkabana nanye muhe ebiteekerezo byanyu ha nsonga zino nibo tumaliraho tujja kuba tugenda ha program. But for now we are going in for the discussion and the moderator is still our brother. Please take it on.
Thank you very much, moderator. I want to thank you for the rare opportunity yet again moderate this esteemed panel. This esteemed panel comprises Rona Najalwami, who is the senior city health educator on behalf of the and welfare. Again, we also have from mental modus operandi for this panel discussion.
Rehabilitation. The first thing they did was to establish the rehabilitation. The first thing they did was to establish the Division of Disability and Rehabilitation under the Community Health Department, which looks into issues to do with disability, rehabilitation, occupational safety and health. So all that falls under the division, and we have been carrying out a lot of activities which is related with issues to do with disability. And I'm very proud to stand here with the support of development partners. We have the first ever rehabilitation and assistive technology strategic plan 2025-2030 to help us guide the delivery of rehabilitation services, assistive product, because without that you cannot do any work, because you will not be governed by any plan. So this strategic plan is costed. So you can get it in at our website, Ministry of Health website. You can go through, because without that, we didn't have everyone can come and just dump their assistive products without any kind of proper guide. So I think that is one of the steps that Ministry of Health
I would like to give 30 seconds to each of the panelists to make.
Let me give you 30 seconds after I say. Just to communicate about the helpline once again. The helpline provides free online counseling, and we have professionals.
Papers, which we are aiming towards assessing the satisfaction of our clients and knowing where we stand in healthcare delivery for God and my country. Thank you very much.
Minister of Health.